పని చేస్తున్నా, క్లాస్ ఉంది చెప్పిన నీకు. ఎందుకు లాగుతున్నావు? కట్ అవుతుంది ఇది. తగిలిందా బాగా? మంచిగైందా?
ఏది We can start now.
ये सुन कैंसिल मत कर।
गुरु ब्रह्मा गुरु विष्णु गुरुदेवो महेश्वरः गुरु साक्षात् परब्रह्म तस्मै श्री गुरवे नमः. A very good afternoon to everyone. Myself Dr. Aishwarya, second year PG scholar. On behalf of Department of Panchakarma, Tarnath Government Ayurvedic Medical College and Hospital, Ballari, I warmly welcome to our respected principal, Dr. Janki Y.S. ma'am, distinguished guest speaker, Dr. Shashidhar H. Doddamani sir, our respected HOD, Dr. Santosh L. Edahalli sir, esteemed faculty members, postgraduate scholars, and all participants joining us for today's webinar on Panchakarma in routine clinical practice, assessment of patient acceptance and therapy. To share their valuable insights with us today. It is now my great privilege and honor to introduce our distinguished speaker, Dr. Shashidhar H. Medical College, Mysore, and an e-postgraduate diploma in epidemiology from the Public Health Foundation of India. Sir began his academic career at the DGM Ayurvedic Medical College, Gadag, and joined CCRAS in 2006 as a research officer. Sir has served as research officer at Regional Research Institute, Jammu, and later served as Panchakarma expert at CARI, Tirupati, Kerala, and is presently posted at CARI, Bengaluru. Sir has been a principal investigator and co-investigator for nearly 20 research projects, actively contributing to THCRP, EMRS, outreach programs, and medicinal ethnobotanical surveys. Sir has published 47 plus research papers in national and international journals, serves as a reviewer and advisory board member for reputed journals, and has been a resource person at numerous national and international academic events. An accomplished academic mentor, Sir has guided and co-guided 28 MD dissertations and currently serving as the chairman of the Institutional Ethics Committee at Sri Kala Vaideshwara's Institute of Ayurvedic Sciences, Bengaluru. Sir has also represented Ayurveda internationally, having visited Russia and the Netherlands as an Ayurveda consultant through Maharshi Ayurveda. With these few words, I now request our esteemed speaker to kindly commence the session and enlighten us with his valuable thoughts and vast experience. Once again, a very warm welcome to you, sir, and thank you for graciously accepting our invitation. Before we begin, I kindly request all participants to keep their microphones muted throughout the session. Participants are requested to post their queries in the chat box, which will be addressed by the speaker at the end of the session. Thank you. Over to you, sir.
Okay, thank you so much for the introduction. I am audible?
Yes, sir, you're audible, sir.
Thank you so much. Respected Principal Madam, Janki Madam, Tarnath Government Medical College, respected all organizer, especially Dr. Santosh Edahalli, Professor, Department of Panchakarma, Tarnath Government Medical College, and under Dr. Vijay Mahantesh, Ugar, Professor in Panchakarma, and all distinguished guests, those who joined online, PG scholars, my colleagues. I welcome you all for my presentation. At the outset, I would like to thank Tarnath Government Ayurvedic Medical College for conducting such a wonderful webinar series. I think this is a 9th one webinar series across India. And at the same time, I thanks for giving me a chance to talk and share my experience. Now slides are visible.
Yes, sir, visible, sir.
Organizer would want me to talk on Panchakarma in routine clinical practice, assessment of patient acceptance, and therapeutic outcomes. So I will go with one incidents earlier in the other where I was assistant professor there and guiding Panchakarma, and we were planning to present all bastis in the audio video mode. For that, we were selecting some persons. For Kshirabasti, I selected one person who is the person suffering from long time. That was a case of FGID, that is functional gastrointestinal diseases, and selected him for Panchakarma Basti, so Shashidhar Kshirabasti. And without counseling, we took him to Panchakarma theatre. There, our scholar asked him to remove inner waste, and he was not knowing that we are giving Basti. And suddenly he came out from the Panchakarma theatre and said, "Sahib, I is battery." And he said, "No, sir, what is this you are giving?" So here, acceptance is Panchakarma. When you are doing Panchakarma, the acceptance play important role, because it was almost 20 years back, and in my area, the acceptance of Panchakarma is very less. Now those people started taking Panchakarma, and based on that, and so many incidents went there during the Panchakarma, the video audio recording. Almost more than 245 Panchakarma Basti procedure we have done, and documented also. And whatever mentioned in the text, in the all texts of Ayurveda, we all collected and we have translated into how to give it, whether in the form of Yoga Basti or Kala Basti, Karma Basti, and whatever mentioned in the text, that was tried. So here the main role in Panchakarma, because here I am mentioning about the clinical practice, because nowadays Panchakarma is practiced under so many things like massage center and all. So that's why I put it here as a clinical practice. When you are doing clinical practice, then the outcomes, therapeutic outcomes a little more. Otherwise, nowadays they are doing 1 day package, 7 days package, 9 days package. It's only extracting the money rather than the result. So we cannot give any scientific evidence for that, and we cannot. And the patient who has undergone the therapy in your clinic will not come back for the same therapy after for Panchakarma. Next, this is my institution, Central Ayurveda Research Institute, comes under Central Council for Research in Ayurvedic Sciences under Ministry of Ayush, Government of India. So, with the mandate of NCD, non-communicable diseases, we have taken up such the studies, as well as outreach programs we are conducting. Collaborative studies are going on. EMR studies are going on. IMR, internal research programs are going on. And more than 25 research projects are with us. Mandate is actually diabetic. And even we are working on more of gut flora, leaky gut and all. So I wanted to explore some incident, some aspect of leaky gut. And it's actually a new concept for modern people, but it is being said in the Ayurvedic text. That I will tell with some reference. So when you say Panchakarma, this is all about Agni and Kosta. So restoration of Kosta and increasing the Agni, they play important role. So Panchakarma means the 5 elements. It comes under so many elements like Bodha Karma, Pradhan Karma, Paschat Karma. They are also adding to your result. For example, if you are going for Samshojan Karma, there we ask the patient to take a rest. We will not ask him to go outside. He will be on bed and the exposure will be very less. Eat very stipulated the food at time to time. There will be stress-free life. That is that also contributes for your the result. So that is called as extraneous variable in the those we are not giving anything, but the person under the patient control, in that way. So that Agni Karma, Agni and Kosta, they play important role in Panchakarma. Integrated, that is Agni, it has a wide range of application, wide range of understanding, simply because that's why the Agni mentioned in Ayurveda, like Kaya Agni, Agni, Bhuta Agni. So the wide range of application, wherever necessary, we have to take that one. In that way, the Kosta also very play important role in doing the Shodhana and restoring of the gut, Samshojan Karma and all. So this is about how we have to start. So if you are going for simple Deepana Pachana or simple Shamananga Sneha, or Vamana and Vireshana. So they all contribute, and ultimate is restoration of posture, because repeatedly posture repeatedly gut get disturbed. Nowadays, because of the food, because of environment, lot of things, a lot heavy food, packed food. So they are, disturbed in their gut. So we want to restoration of posture, restoration of gut is very important. That we can achieve by the Panchakarma. So interesting note, probably I don't know how many of you know this one. This was very interesting fact for me. And when we were studying they used to say the Shaka moves from the doshas move from the Shaka to posture to Shaka. There was a confusion. Some people understand Shaka means other four limbs, head and all. But it's very clearly mentioned Shaka, Prasad. How it gets into systemic circulation. So that was the thing mentioned in the Ashtanga Hridaya Sutrasthana 13th chapter. Here, Vyayama, Ushna, Tikshna, Aita Acharana. So that includes everything. Here, an interesting note to see here that exactly resemble leaky gut or more or less. But this is after reading this leaky gut, I came to know that it is mentioned in our text saying that, because while reading, what is that? Vayama, Vishna, Tikshna, Aita, Acharana. So how the doshas move, that was not clear and not clear by anything. Now it can be cleared by the scientific. This is you can take as one example. The blood flow diversion. So you see, once if you are going for Vyayama, considering here it is Ati Vyayama. Ati Vyayama, if you are doing, that 80% of blood flow towards the gastrointestinal tract will be there. If inspired soon after Vyayama or something, if you are going for a heavy exercise, then the leakage of, you see very clearly as mentioned, it increases the gut permeability, that is called as leaky gut. The physical stress also elevated. Body temperature, you see, now stress we are now, the people are not doing any work and they say we are very much stress. The acceptance and they are not facing the problem. So that simple stress also, what happens, elevate the body temperature. That loosens the tight tension of the intestinal wall. This allows the toxin, you see, this is not from Ayurveda, this is from the modern text only, you can take it scientifically. This allows the toxins, they are also not clear, pathogens already present in the body, undigested food leak into the bloodstream, directly it goes. That is the concept of Ama, how the doshas move from the posture to Shaka. So this is the pathology very clearly mentioned. Now they have come with the leaky gut under the light of NCD, non-communicable diseases. This is also added on to insulin resistance. So this is the one area where I wanted to explain about this leaky gut also. In future slides, we talk on the gut flora and all. That is also very interesting. So how we can take up the cases based on their diseases and we can adopt the Panchakarma therapies. So this is one beautiful picture. You could see how the first one, my right side, normal gut is there, it's not clear one, and the other side is leaky gut. You can easily visualize the difference. So this is the tight, that is called as healthy tight junction, whereas there is a loosen or faulty tight junction. So that is there is a mucous membrane is there, the good microbiome, gut microbiome is there, gut microbiota is there. The side, other side that is vanished because the gut bacteria is completely gone and mucous layer is gone, and it allows the other particles, toxins, unwanted food, the Ama, the concept of Ama that is entered even in other cases like virus, because it should not allow into the system circulation, whereas it goes in this way. So this is a type of the posture to Shaka. It clears with the scientific evidence, and we can think more on this in future also. It's not a final what I say. This is my perception after reading the biochemistry and recent gut microbiota. So this is my perception, and you can add in discussion. We discuss it later. And for that, what we have to do? So this is gut, because that is said in our text, very known sloka, doshaha kadachit kupente chitarlangana pachani hetu shodharme tesham punar udbhavaha. So this is said in the text. It is very known sloka for all Panchakarma thesis students. You should, as we know, seasonal variation will be there, food variation will be there, repeatedly gut going to disturb. For that, we have mentioned the Shodhana Karma that is called as Malanam, Nirahanam, Shuddhi. So here it is, they said, Doshanam, Samek Upakrama, methodical expulsion, Bahirniranam. So it should be expelled out. You see, it should not run inside the body, and it should be expelled out by the Shodhana. Shodhana procedures are being mentioned. More of I will touch here this time, only that flora and fauna. So we need to go for Panchakarma. Or the Panchakarma start with, you see, that was I said earlier in same Sashtanga mentioning, and how the doshas move from the Kosta to Shaka. Here in those Dakla very clearly mentioned, and that can be achieved by Panchakarma. Doshaha Shakasti, because the Soto Mukha Vishodhana, Ridyat Avishadana, Pakat, Kostam, Vayushnikarana. So this is the slogan mentioned how you have to bring back. You have to bring back the doshas which are circulated in the body to Kosta, that is almost liver. From there you will keep out either in the form of Vamana or Vireshana. That's the standard rule. For that we are going for Purva Karma, Pradhana Karma, that is there. So here very nicely the opposite direction, there the doshas move from the Kosta. Here how to have to bring back Vrudyat, what he has says, Vrudyat, Abhishandana, Vruddhi, you have to increase in their quantity. Vishandana means Vilayana, though it will be liquefied, that is very clearly mentioned. That is achieved by the Snehapana, because in Snehapana we are going to give the ghee in the increasing water, where the more bile acid is formed, that is Vruddhi, Abhishandana, that I will explain in the next context. So you see, simple Deepana Pachana, Deepanam Nama Yadravya Agni Deepayati Na Amam Pachati. So this it's very difficult to bifurcate Deepana Pachana, but how usually we give Deepana Pachana in our clinical practice, usually I go with the otherwise Trikadachuna. Trikadachuna is the best among all, because what is said in Deepana, that is Pipali is there, in Pipali the peppering content is there. That is nothing but a prebiotic. Recently I read the prebiotics are one where they are not get digested by the intestine. Only they reach the intestine. There by with help of gut flora, gut microbiome, gut bacteria, it is they form the butyrate. You see, simple Deepana Pachana is, that's why they have given Langanam Deepana Pachana Dosha Vasechana. In the beginning stage, you can handle the disease or any like Ama stage, you can go with only Deepana Pachana. That's very clearly mentioned. And the that I will explain. So here it is there from the Deepana Pachana. More of Deepana drugs, they help for secretion of the juices, enzymes. And Pachana drugs are, they make, they digest the particular thing that is there in the book. So here Pachanam Namatadravam Amam Patati Na Deeparati, because after once once it's there, the Pachana drugs is there. And in some Sutrasthana, Langanam, Pachanam, Chaiva, Amadoshishya Besham. So Langana is also mentioned in so many in Amavata and all. So the Deepana Pachana should be carried out before going to Snehapana. So this is a very clear picture. This is recently I got to know about this. We are all talking about this short chain fatty acids. Very plain important role, because we have earlier had the hands-on training on gut microbiome in our institute. And I astonished to know so many things from that hands-on training. Here, very simple one. If you are taking any dietary fibers, they are called as prebiotics. They are not going to get digest. They will go to the gut microbiome area. There they form the butyrate. So that subsides the inflammation of the gut. You see, simple. That's why you have to eat every day. That the fiber content, the fruits or vegetables. That is simple form, routine or for dinacharya. If you are taking the drugs like Deepan and Tricketu drugs, even as I told, pepperine and all some Ayurvedic drugs, mainly Ayurvedic drugs contain the prebiotics. They also do same thing and they reduce the gut inflammation. Because and modern one more the contribution from the modern what they say NCDs, non-communicable diseases are caused due to the long-standing chronic low inflammation. So in such diseases, we have to go with such things. So gut microbiota, from there, the fermentation takes place and they say the butyric acid, or they prepare, gut only prepare the short chain fatty acids. This is there. And if you are going for grata, that's a ghee is mentioned in our text, Runam Kritva Gratam Pipe, very saying is there, not in the main text, but it has a very importance because it was used widely in the Ayurveda, saying that because it contains short chain fatty acids and also medium chain fatty acids. So short chain fatty acids are, it liberates the butyric acid. That's why it does the slow inflammation and it reduces the inflammation in the gut. So this is all about the, even if you go with if you are not going for Arona Snehapana, simple Snehapana, no, I am adopted simple Snehapana for diabetes patient, just 15 ml, which is the permissible amount for any kind of person. That is the best, and because it secretes the butyric acid, that is reduces the inflammation of the gut. So this is all 1, 2, 3. One is food, then prebiotic, then grata. What exactly they do? It's not only the local action is there. It has grata. You said meda because it is a meda. It takes care of brain health and immune system and also metabolism. So this is all about the short chain acid. We can dig it more and how exactly our the snehana in the form of snehana. Actually, usually this is more applicable to Shamananga snehana. That's why now I will show you at the end of this talk, I will show some slides. I tried with Shamananga snehana, like 15 ml, which is very feasible for any patients. So this is about the short chain fatty acids. So this was already I told in prebiotics or non-digestible fiber that are the food beneficial to the gut. So gut it takes and they form the butyric acid that is there. That helps in the together. They help to promote the optimal digestion, nutrition, absorption, and care. So now I'm coming to main part of Arona Snehapana, then increasing orders of Snehana. This is my topic. Actually, at this junction I should remember renowned Panchakarma specialist Shashidhar sir, also my teacher CM Sarangar sir also, who taught me regarding that. And that time we were not receiving any Panchakarma and all. Most of the time we went to Ballari for seeing Omana, and earlier they had some Bharatiya Darshana regarding Panchakarma also. I was in PG, as a PG student, I went there, and Dr. Anjamud sir was there. They all taught us regarding this. So Snehapana increasing, though after Deepana Pachana, what happens? That is to check the liver whether next day we are going to, next day or after 3 days we are going to give a Snehana, that is the Mushita Snehana or Mushita Grata or the particular Grata. What happens? So we need some bile acid to digest. That's why you pre-check through the Deepana Pachana, whether sufficient quantity of bile acid is there or not to digest tomorrow or next day giving Grata. So initially we start with 30 ml or 50 ml based on the poster. That assessment is again on top. And we go with the 30 ml. 30 ml if you give, at the end of 24 hours, within 24 hours, it converts into again bile acid. Actually, the fat, the cholesterol waste will be bile acid. You see, how it is, Vruddhi is going to place is giving Sneha. That is, Vruddhi is only by Sneha. It is mentioned in the text, not other things. Why? Because when you are doing cholesterol waste will be bile acid. So that bile acid pulled into the bile juice. So that will circulate and it is responsible for digestion of fat in the stomach. And what is going to happen during as soon as I take 30 ml or 60 ml or 90 ml of the grata, it will not get digested by the stomach immediately. It takes 2 hours. That is called, there you will see some Jiramana Lakshanas. Because under the process, because there is no bile acid at all, and it's not able to digest the fat, during the Jiramana Lakshana, the patient or the person will get a drowsiness, will not sadhana, gaurava, no, all Lakshanas are mentioned because there is no digestion when fat is there in our stomach. As soon as it gets into the duodenum, actually fat metabolism starts, there bile acid contacts and also pancreatic juice will come and start digesting. End of that day, particular day, the snare get digested, all snare Jirna Lakshanas are seen. So this is all, the scientific way they are mentioned, Jiramana Lakshana, Jirna Lakshana, some mixed Lakshanas are also mentioned. So today I am giving 30 ml, next day 60 ml, because as you are giving 60 ml next day, you should have bile acids that much to digest. That's why periodically we are going to increase. Once it is increased, after 7 days, huge quantity of bile acid is secreted. Either it should be vomited, or you should be kicked out either from the Vamana or Virechana. That's why we are not going for a long period of Arvanasneha, because that will goes out in the stool, it goes out. That is Snehasthita, that it goes down. So better you have to decide the person how we consume, and 3 to 5 days. Usually here I will do 3-4 days, 5 days, maximum 7 days in some psychiatric disorder with a heavy dose they drink. That is there. So this is all the huge quantity, end of the Arvanasneha, huge quantity of the bile acid is prepared, synthesized. You see here, the same thing is there. Ingested the fat like a ghee or senna, what it has doing, even it does gut lining direct the lipids to send the mechanical and chemical signal upwards with the vagus nerve. Because this all Panchakarma procedure, Vamana and Virechana, they use this vagus nerve only. And that is a actual link between the CNS and even enteric the nerves. So this vagus nerve stimulated either by Vamana or Virechana, so that reaches the brain and leading to Shodhana. So I most like figure in the Panchakarma, this is called as a biliary tree. And this how the Vamana Virechana, this area played an important role. When I was busy, somebody was doing we are doing some work on Arvanasneha Pana. That time the person took the blood of the patient, and the same thing he uses in the preclinical studies. And ultimately what happened, what is the result is said. So if you are going like this, that increases the bile acid. The biliary secretion is more, thus it acts as the dyslipidemia action, hypolipidemia action. You see, here what we are giving grata. Their bile acid is formed, and that itself helps in the increasing the lipids that was there. So these are all organs helping the liver and this duodenum. This is called biliary area. I say this is only the Shodhana area. The biliary tree is a Shodhana area, because there is no other such a reference in modern text like elimination or taking the toxins outside. only in Ayurveda it's mentioned. That's why how we follow like Deepanapachana, then Snehapana, then when the doshas, Utklesha. Utklesha, I wanted to talk about Utklesha also. Here what is it? Utklesha iti, Kaphaduklesha, Utklesha iti, Pittodklesha iti. Because they are Dravata in Guna, we are going to increase. When they are increased, Utklesha comes out. Either from the upper part of Vamana, and if there is no dog replace or the person is not fit for Vamana, we go for Virajam. So this we have to study and in detail. And one more interesting, I read it, the bile acid triggers histamine release, you see. And when we are going for repeated Arona Snehapana, actually, I was telling about the Pitta Vruddhi. What happened? Pitta Vruddhi itself, the bile secretion itself, that triggers histamine. Histamines which are responsible for vomiting. You see, we are doing, unknowingly we are advising you eat that, curd, you eat that thing. But already with the help of Snehapana, that bile triggers the release of histamine. The interaction between the bile acid and histamine is a bi-directional, the two-way the street. Histamine can influence the biliary function, and the toxic, you see, the toxic because now we have huge amount of bile acid is formed in the body and circulating, and toxic bile acid can stimulate the histamine. Once the toxic bile stimulates histamine, then the person gets the aversion or what Utklesha vomit from the mouth. So this is because simply we are not asking the person to vomit. We prepare the person methodically, scientifically. That's why they will not come across with a lot of complication. Even during Virajam also, we have seen the person passing 30 times, 30 times, 36 times also passed on earlier our staff was there. Nothing happened because we prepared a student, the person, the patients in that way. So other area of this is untouched. Here, the why we are going for Pakshat Pamanam, Masat Virachanam. So this here the allergy there, the histamines are of 4, H1, H2, H3, H4. Their area also is mentioned, and the skin disease in psoriasis, vitreous person within 15 days will become normal. After 3 months or 6 months, he will come back with same. We also have seen in the OPD because these are going to increase, or the diet, that is increasing. So these are all there in the brain, neurotransmitter, inflammation, inflammation, stomach. So these also these are all touches, all bile acid touches this area that is come to liver and from there. So this is the area of where even bile, you see, bile also go to brain, that also I read. It's not this bile, this is called as primary bile and secondary bile. The bile secreted in gut, bacteria, they make it a secondary bile and they reach the brain. Even brain has a capacity to prepare its own bile acid also. So in that way, we say, they are Vishandanath Pakat, we collect all the toxin from the body. This one picture, we can assume how it could be. This is the most one. See, simple, the bile is a very clear picture. From there, we will be vomiting because in Omana, it's there in next slide. What does bile acid does? Fatty acid metabolism it does. Secretion of waste product, you see, is already there in the modern text. And the bile acid itself, acids or bile acid itself are acting as a detergent. Every day they act as a detergent. They kick out, and 95% of total 100% of bile, if it is secreted, 95% of bile absorbing the small intestine, it get into systemic and the portal way, and other 5 only leak out in the gut. Then it kills the bad bacteria, and even you see blood sugar metabolism also it controls. That's why if you are going for shamana kind of the brata for a long time, it is good for diabetic patients also. So many people ask, no, diabetes patient is clearer than a valley. The brother does the clear, but as you are giving very lesser quantity, it can be because it's a very minimal dose which is required for the body and helps in the sugar metabolism. How interesting fact you see. We are giving snehana. After snehana, every day that whatever you are giving snehana, that is get absorbed in the gut. And you go to the via photon, it reaches the liver. But what happens, that is in case of only short chain and medium chain. That is that's why ghee contains that thing. So ghee is eligible to absorb immediately here, and it will get into it has a VIP route. So it will go to liver. Other, if you are eating any gobi manchuria or anything extra, oil outside, they are containing large chain fatty acid. They will not absorb. They will absorb with the lymphatic circulation. See, that is not eligible. It will go and then it is liver in other area and get into the system circulation. Then it will come to liver. So that is there. Vrata, they said. Samskarasya Vartana, which contains single bond and saturated, but it contains a small chain fatty acids and medium, and it will absorb immediately. So that is also there. You see, the lymphatic system transport the dietary fat from the digestive tract into the bloodstream. Though the specific structure that lacteals, that chylomicrons, we say chylomicron, which is like the color, and that that will not absorb in this route, and it will absorb by the lymphatic vessel. Then it will go to the thoracic duct. You see, it reaches the thoracic duct. From there, it will deliver to heart, and it will come to systemic circulation. This is how there are also the two things are also there. So that's why better we choose the only, not the refined oil, that oil inside. Next one. So what happens in Vamana, as I said, it makes utleshana. Unnecessary if there is no utlesha, don't choose the person or anybody for Vamana. Because some people, they want to conduct Vamana therapy. You have to see check to reflex. Because in classes, for Vamana, Virechana, whatever they say, fit and unfit person, nowhere it is being said in any modern, even for surgery also. So they clearly mentioned how to choose the patient for Vamana Karma. And what happens? This bile acids, in Vamana Karma, what happens? You see, if we ask the person to drink the ST Madhu or Ikshu or milk, as soon as we drink, the pylori trend is closed. Because we are not giving medicine. You see, so how they are engaging? They are not giving any woman drug or woman drug immediately. Because if you give that, the digestion starts. But in woman, we should not allow the drug to digest. That's why what we have to do, we go with Akanta Purna. So because there only the stimulation will be there, and reaches the already CTZ center. So even this Vamanopaga drug or Vamana, the drugs we are giving to continue the process, because within 45 minutes or 1 month or whatever you see, the bile should eject through the mouth. Balat urdhvam nayati is being said. So it's not that Vamana have given, you will vomit, you will not vomit, you are forced into, because Balat urdhvam nayati. You have to make forceful, because you cannot say you are very patient, you are that patient, this patient, or also it's not being said. Because you should not allow the given drug to digest. So once you start, because once the vagus stimulation in the stomach, that trigger the center, he will vomit. He will vomit, and once it is get empty, the stomach get empty, the bile gets into the duodenum, then it will come out through the mouth. So that's why this is the best way of food. But here in Vamana, what happens? The bile acid, whatever collected in already there in the gallbladder, we will get eliminated. But in Virechana, I will tell how it comes into how it should be eliminated. So this is all Omana, you may be knowing. That's the best. This is nothing but a vagus stimulation. Vagus nerve play an important role. That play an important role in not only here, even in Basti also, in Virechana also. So here also they have given blood-brain axis. Now it is true. We are not just simply cleansing the colon or gut. There is also impact on even blood-brain the brain also. Yeah, in Virechana, why Virechana, when pitta is collected, we ask the person to drink take it in empty stomach. It should get digested. For pitta, you got to request to calm down. So there in kapha, you got to expel it out without showing any mercy. Here, I was wondering why in a classic it is being said 10 times, 20 times, 30 times. Because the intention is to kick out all pitta collected in gall. At a time, irritation will not come to gallbladder, bile not come to gut. Slowly it will come, slowly leak out in that. That's why. And moreover, a very interesting point to note here, whatever pitta is released here, usually 95% of bile salt, bile is absorbed in the gut. But here we are inducing the Virechana, we are ending Virechana 5 times, 10 times, 20 times, 30 times, because we should not, the bile acid should not be absorbed in the gut. That is the intention. Not that simply 10 times over 20 times over, because if you, that's why based on that, how much bile is expelled out, based on that we have done this Panchakarma. That is also very good. Because here it takes much time, and whatever bile is there in the body, circulating the body, slowly it goes through this route. The intention of whatever 95% we absorb of bile, that should not absorb, and new bile acid should synthesis. It takes 24 hours, more than that. That's why in Samshojan Karma, they are asked to go for Samshojan Karma, pay and all, where it contains more of starch, there is no content of fat, because already they knew it. Bile acid is only responsible for digestion of the fat. That's why they are so intelligent. They asked to go for 3 days, that we can say that is carbohydrate diet. Then they ask to go for they add some pulses and all. That is protein diet. Then they go for that is all we're adding the and all. That because by that time the fresh bile acid is formed and restoration of gut took place. And interestingly, I worked on that, and Dr. Sadashiv from the Doddamani University, and is guiding for some sort of Dr. H. We have come out with we have replaced the Raktashali in the Samshojan Raktashali with millets. That was done by Dr. Sadashiv sir and scholar Ajay, and I guided, and Dr. Sharangoda Patil is there in another university. So we have come out with that was fortified, and we have replaced Raktashali with the various millet in the different ratio. So this is how we can how to restore this for Samshojan Karma is the restoration of gut, because it contains trillions of small and large intestine, contains trillions of the bacteria that is scrapped out during this procedure, and you have to re-establish, and you have to make the new one. And very interesting, it's mentioned as you are saying, gut-brain axis. What he says, Indriyanam prasadascha buddhir meda. So you see, not only it's not localized, and here also it says in Umitasya Lagava Bhakshaha, because it takes out all kapha, Shuddhi, Kantascha Agni Deeptir Manoharshaha. So you once that is there, Kapha Dosha Kshaya Bhavet. So this is saying, and for Vireshana he says, Agni Dipti Bhavet, Indriyani Prasannani Buddhirmeda Vardate. You may have experienced that once you pass the stool, you feel very lighter, very fresh. So that because the amount of the pitta goes out from the body and helps in the destruction of gut. So this is also very interesting. We have done work on gut-brain axis, how the enema, how it helps the. That's why we have to stick on to the what is mentioned in the Ayurveda, like Yoga Vasti, Kala Vasti, Brahma, and don't mix so other medicine to push inside the gut, because that may create the lot of dysbiosis. So what is mentioned methodically they have mentioned, so that this from there this is called what is that? There's enteric nervous system, that is the informed to the vagus nerve, then that will go to the brain. So like that the how because I'm in our institute every day we are going for 100 Panchakarma. There are almost 28 patients, means we are more than 20 for 20% we are going for Yoga Vasti. They are getting a lot of result in neurological disorder, other disorders, because of it is directly connected to the gut brain. So this is one area where we can work, and simply not so many people say this is only colon wash, that wash, this sort. It's not like that. It has a systemic action. And with this, I told more of a theory, because I thought of youngsters, Panchakarma youngsters are there. They should know about how the exactly Panchakarma works. Simply not, nothing in a different thing. And here, I will show some of slides regarding the assessment of patients. When we were doing the documentation on video clip on the Basti, that was on Vaikana Basti, and Anjamu sir said us to do it. And during we have conducted one Vaikana Basti for one woman lady, and soon after we prepared another one. The lady, the first we have given, she went to toilet, and the other one we have given, she also has to go for toilet. So we are not knowing that it comes so fast, and it is happened like this, because we have to check with in Virechana or in Basti, the toilet should get opened every time. And this was a lesson learned from that day, and she did outside only. That was the thing that happened. Such things, so many incidents are there during Panchakarma. Almost Panchakarma, if you are conducting Homana, and it will not be same for next the patient, it will be different. So every day, every procedure will learn. And this is one recently, this Naveen Kumar, the patient admitted in our hospital for some tingling sensation. They thought some Vata Bhayadi and they went for massage. So after 7 days, I asked them to go for HbA1c. HbA1c was 30.5. Then we were afraid of taking any medicine, and we started this Nepana, Dhanvantari Vrata. It's a 15 ml at 6:30 for 7 days. Then there will be a gap of 7 days, and again same thing, same procedure is repeated. So this is because of why we are giving this. We want to check whether patient is feasible to take continuously, or 1 week they are going to take adhere to that treatment. In that way, we have done after 3 months, and that has come down like 8.8. And now even recently it's checked, not recently, in the month of February. Now the HbA1c is 7.7. So many questions are asked. I don't know why you are giving Sneha Pana. In the Madhume patient, where play there is more. Nothing will happen, because lesser quantity of the Grata, as I said, it nourishes your blood flora and it reduces inflammation. Even that small, that itself is the maintain. The insulin sensitivity is increased. You can try. If I try, means you can also try. Definitely it will be the result. And even methodically, you will check whether patient is taking your same medicine. And that is that's why I told there is acceptance and adherence. And with that, then what is the outcome? Then I implement same strategy for other patient and we go for a public patient. These are all the outcome of clinical. So this is one interesting and is there now it has a HbA1c test. So another one is it's not clear. This is a meniscus tear of age 44 years male. 44 years male, and we came with he was not able to walk and swollen joint was there. Then we tried all Panchakarma. Panchakarma means usually what is a standard treatment here. We go for massage. Then I did the local basti, Jano basti, and yoga basti, which was given for him. And after that, and there was no change in the meniscus there. It's as it is, it's there. But everything is the symptoms are reduced. The patient is able to walk, run, even go for cycling. So this is a kind of another clinical outcome. And I asked him to go for surgery when he was not willing to go for surgery because of Ayurvedic pain. And then we did it. Ethically, I suggested him better to go for that. And now he can able to carry out his and he's doing everything. So this is also one outcome of Panchakarma where we have done in our hospital. And this I listed and I published this necrosis permia patient, the 58 years old, married to some 35 years, then second married lady. And here importance is Palagrata was given for the Palagrata 15 ml at 8 a.m. in the morning. And this was assessed after 3 months, it was increased. This also published in IU took much time to publish and they published it. And because of that, we are getting the patient. This is also what is the clinical outcome reflecting the publication. And I am getting a lot of patients in this direction also. And recently we have treated, I have treated one thyroid node. It was 25 mm, and now it has come to just 5 mm. That there is not the report is not with me now. And this is the same person I was telling about this necrosis permia. And interesting to note that he was on the necrosis permia treatment. After the treatment, he brought his earlier photo saying that sir, my white patch was like this. After your treatment, I become like this. And we were not trying to treat the Switra, but astonishingly, we got this returns. These are some outcome of clinical practice. Usually, we treat so many cases, we will not document. They come and they say, Chanagide. So that was not documented. So with some clinical evidence I am showing you. And recently, we are doing Shiro Pichu with Ashwagandha Churna, 3 grams BD in insomnia. The patients are very happy. You see, this is a collaborative study with the Ayurvedic Medical College. They are treating with the line of treatment. Treatment as usual, they are giving their pozolam, whatever they have set up medicine, they give it. One arm we are treating with the Shirabalatela, which is simple procedure, it can be done anywhere. We have not modified much. We have a small SOP in our institution, we are doing. The person also gave very good feedback. And the patients are, more, they want more of Ayurvedic treatment because we are, this is randomly allocated. The patient may not get, all patients may not get the Ayurvedic procedure. They say we want Ayurveda. So somehow we are pushing some patient to that link also. This is we are doing it our institution. Earlier also in 2004 or 4, we have conducted a Mastika in Gadag also. Dr. Santosh elderly is professor in that college. They were, they did all this Bastia, the Chikitsa, this Maskishka 2004. They were a scholar, they did it, and we worked on Basti extensively, not documented, the scientific evidence, it takes much time. For analysis, it takes much time. Though I am in research, the organization, everything will not allow to document scientifically, and we have bound to such rules. So with this, I conclude my talk. And once again, I thank organizer, principal madam, and thanks to Dr. Santosh Reddy, who has done this webinar possible. And I thank everyone for giving me opportunity. Thank you and all. Any questions is there? Then I will take up questions.
Thank you, sir, for your enlightening lecture. Your vast knowledge, practical insights, and valuable experiences have greatly enriched our understanding. Now we shall move on to interactive question and answer session. I request the participants to kindly post their questions in the chat box. Dear participants, if you have any doubts, kindly post the questions in the chat box.
Chat box. Can you read, please? Aishwarya, Dr. Aishwarya. Hello? Hello?
Sir, there is one question.
Yeah.
Sir, only Gritapana is enough for increasing the insulin sensitivity. How to decide which Gritam to be used in diabetic mellitus cases? Sir?
No, you see, this I tried in pre-diabetic, type 2 diabetic, and type 1 diabetic also. Thing is, not done because for everyone we cannot do Shodhana here. I select Shamananga, not even fit into Shamananga. We are giving less dose of Grata. Usually, preferably I give Dhanvantari Grata. Even I use Tripla Grata also, which is not mentioned. Tripla Grata also I use. Otherwise, whatever Grata available in our dispensary, I use. That is a dose of 15 ml for 7 days. And there will be a gap of 7 days because they should not get any because this is not a lifelong disease. We cannot ask them to take for longer period. So I keep for 7 days, and there will be 7 days gap, and I keep for 7 days and gap. So monthly we have to take at least 15 days. Then for 3 months I will evaluate the HbA1c. Definitely you can also do it, it will be reduced. And whatever they are taking, I ask them to take same medicine, whatever they are taking for diabetic or type 1, type 2. And after seeing the HbA1c, I will minimize the modern medicine. The intention, even the same proposal I will went over a reporter saying that. So this helps in minimizing because type 2 diabetes you cannot handle or type 1 with the Ayurvedic only Snehana. So we can give a best the quality of life, and we can minimize their the dose of the medicine, modern medicine. That was the intention. In type 2, I am trying to minimize. Then only the patients start coming to us. Now we get more than 100 patients every day, diabetic patients, because somehow we are giving maximum relief. They are coming.
Okay, sir. Thank you, sir. Next question is, please explain Shamana Sneha Matra, sir.
No. Actually, that is there in the classic. It will be more in dose, but I am not adhering to that because we have to check because long time you are giving. People are fearing to take a ghee. So I fix 10 to 15 ml. It is about 150 calories. That is easily it can be given to anybody, for kid also, for even disease people also. Those who are physically very strong can increase for 30 ml, but as they are diabetic patient, considering the Meda, Kleda, Kapha, I suggest only 15 ml. This is my thinking and I am getting result.
Okay, sir. Next question is,
No,
sir,
yes.
Sir, share your experience on Uttara Bhaktika Sneha Pana and its matra duration.
That is no, that can be considered as no, our what is that? That I am not trying. Otherwise, Aruna Snepana I do this conception. Uttara Bhaktika, that is mentioned in the I forgot the references. I will tell you later once after this question.
Okay, sir. Sir, plain Grita versus Samskrita Grita, how does it differ in Shodhananga Snehapana procedure?
Actually, even Acha Snehana is mentioned directly, Snehana can be taken, no problem. But what happens if Snehana is more, no, you get some related, you may get cough, cold, because you cannot drink 30 ml, 60 ml. Better you go for Murchita Snehapana is the best. I am going, if you are going for Shamananga, you have to see the context of the disease. Otherwise, Acha Snehana, otherwise, plain Grita is also good if the person is eligible person. Aruna Snehana, I have not given any Acha Snehana, dilate Snehana, like 60, 30, 60, 90 ml. But Shamananga, it can be given like 15 ml every day. Even it can mix with some
Sister?
Hello?
Yes, sir, you're audible.
Yes. The 15 ml Grata can be given. See?
Okay, sir. Sir, what is the importance of timing as the Shamana Sneha Pana was given at 8 a.m.? Can it be given in divided dose in the evening also?
No, for Shamana, no, Vicharana Sneha, it can be given any time. But what I do, why I am giving empty stomach in the morning, because if you take 1 cup of tea, the insulin has to come up. In the diabetic, what I am saying. If you are going for, if you are taking ghee, the insulin will take a rest. In that way, we ask the patient to drink early in the empty stomach. It takes 2 hours to digest, and I ask the person not to take anything because let it act. And the person will be on 2 hours. He will not take any. The insulin will not come into act. That was also main motto. Then after get digestion, I ask the person to take the same food. So 8 o'clock, preferably I have given for that patient. Here in my clinical practice, I ask them to. After brush, you have to take like so. As soon as you wake up, then I ask him to take the medicine.
Okay, sir. Sir, could you please explain about Avapidaka Snehana with the dosage? How practically it can be adopted in our practice?
No, that I am not doing. That is there before food and after. Same question was asked. That is, I am not doing in that practice. That only academically you can do it, but in clinical practice, what I say, routine Panchakarma, that is very difficult. You cannot follow also. For clinical trial, you can take. Okay. So
Okay, sir.
Theoretical part, you do it for your thesis, but that is not, applicable for routine Panchakarma, what we are conducting.
Okay, sir. Sir, is Grita advised in all Vataja, Pittaja or Kaphaja, that is with positive urine sugar also?
Yes. Because why it said, it reduces the, inflammation. That is the main thing. Why it is given, it reduces the inflammation. All the diseases are originated from the inflammatory gut inflammation only. As I told, it contains small chain fatty acid or butyric acid. It subsides that inflammation. In diabetes or in hyperlipidemia, in hypertension, whatever, the resistance diseases, insulin resistance disease, you can go with that. Even Vata Rakta also. In Vata Rakta, a lot of, the Gratas are mentioned. So usually what is available in our thing ID, even I tried earlier also in PG. I go with that only in diabetes.
Okay, sir. Sir, you mentioned about toxic bile acids will trigger histamine release. In patients of chronic respiratory allergy, we should consider blood cholesterol level. Any relationship with respect treatment, sir?
No, you're talking about the Tamaka Swasa? No, you are asking about Tamaka Swasa?
Yes, sir. Yes, sir. The question is like chronic respiratory allergy, sir. Yes, sir. Tamakashwas.
Tamaka Swasa actually mainly the woman is indicated. They have given specific time during that period only. You have to conduct the woman. Otherwise, you have to go for Tamaketi Virechana. It is there. That is different. But usually I go with the woman only. We have to check the patient fitness and all for woman. Here we are not doing any woman for all kind of patients because it's a government institution. And in Bangalore, we are after all checking only one ECG, then only we do woman in our institution. Respiratory, the woman is the best therapy. Woman is the best choice of treatment, Panchakarma treatment.
Okay, sir. Sir, how can metabolomics, microbiome sequencing, and neuroimaging be integrated to the study of effects of Panchakarma on the gut-brain axis, sir?
Yes, that you have to take up because I also tried so many proposals I have given. Even I spoke to so many biochemistry people. They are not ready to come forward, and even this was my dream since long time. I wanted to do that study. Not possible. You have to conduct big institution. They also come forward, and I am searching for that. Even so, I spoke to so many biochemistry persons, expert, and they listen to me initially, and they'll not turn back. So that is there. You can do it, but very expensive also. In even CCRS also, we are documenting all the Shodhana therapies with the scientific evidence that is there, that is going on. Once it's done, we will publish it. It is available for public. It will be in public domain in future.
Thank you, sir. Sir, please tell the role of Panchakarma in treating lipoma. Apart from medicines like Kanchanara Gugulu, etc., what in the best possible way via Panchakarma to treat this lipoma?
Best means repeatedly you have to go for Shodhana, the woman. Then the Kanchanara Gugulu is the best. Kanchanara Gugulu and I give Arogya Vardhanimati as it contains the Katuki. There, Nitya Shodhana takes place. The Katuki is a very choice of drug in all that. Pitta related disorders, Meda related disorder, Kapha related disorder, that is the best one. Arogya Vardhanimati and Kanchanara Gugulu and Vamana, they got to see that the patient condition, you can go for Vamana, then followed by Samana. Then we have done that same thing in that patient. He got very good result.
Okay, sir. Practical use of Basti in Madhumeha, Prameha, other than Somavalkala Siddha Kashaya, sir.
That I will not, because I forgotten all the Basti, because I tried, even Dr. Santosh, your sir is there, he is a witness. We have tried almost all Bastis mentioned in all texts. We listed and we tried everything, including Rakta Basti, Sneha Basti, Kukunda Basti, Raja Apana Basti, Musta Apana Basti, Ardhamatrika Niro Basti. Whatever Basti mentioned, I tried. Now we are not practicing with almost 20 years more. What is feasible in our routine, I am doing, not that much theoretically. I will focus on that. That we will discuss later. No problem. That is not even very routinely we cannot conduct. That's why I stick on to only Yoga Basti. Usually I go with the Randamula Yoga Basti in our institution. In the condition, we go with Vetrana Basti. That is we limited to that. We will not explore such Basti after that event. And those who ask no, you can give my number. Let me. Otherwise, they can they can talk to me.
Yes, sir. Okay, sir. Sir, next question. Sir, have you practiced Vasapana or Majjapana for Snehanartha Snehapana in your clinical practice? If yes, could you kindly share your experience? Also, how do you procure Vasa and Majja for therapeutic use? And what is your method of preparation before administration?
Actually, see, I tried Grata and Thaila. In my thesis topic also I used Tilitaila only, Musha Tilitaila I used for hypertension. But Vasamaja we have taken, we did it in Mahasneha Basti. In Mahasneha Basti we brought that Vasa, that boiled and we extracted it. Majja also we have done. For Basti purpose I have done long back only. That is possible also you can, but not for the Pana, not Pana, for the Pana. For Basti purpose we have done. It is there with documentation is also there, video is also there with how we have done. That is all shown in that video. How to procure it, how to melt it, how to, that is done. That is called Mahasneha Basti. Huge amount of Snehana was given. After that, the patient was very lethargy and he was facing so many problems. And though it was given more than 1000 ml, it took much time to come out. That is my experience. Now we are not practicing such things. Only simple process we are practicing now.
Okay, sir. Thank you, sir. Next question. How Gruta and Taila Sneha Pana varies based on its saturated and unsaturated fatty acids level in terms of modern, sir?
Actually, even the both contain, even Grata, the Grata, the ghee contains more of saturated, little of unsaturated. And the Taila, they contain more of unsaturated. And any animal, the origin will be saturated. If you are taking from the vanaspati, the vegetable, they will be unsaturated only. And once it, that's why they later after I highlighted on the Murchana. Once you are doing Murchana, that's a good for, that is a good one, they are eligible for ingestion and intake. That's the best thing. So Snehapana with even you can go with, but some Sneha, the Snehas contain what I told, this long chain fatty acid, they may not absorb immediately, they run through the body. That is there. That is the best option I give for everyone. Grata only, because in my study I tasted this one. It's not easy to consume. The patient may get aversion. They may vomit during this Snehapana. That is also there. The feasibility or adherence of the Grata Pana is very good. Grata is the best choice of formulation. And no doubt, Grata is a saturated. And what we are getting from the plant origin, they are unsaturated fatty acids. And the thing is for going for Arona Sneha, nothing problem. You can go with that also. If you are going for long term, thing, you have to accept it.
Thank you, sir. The last question is, sir, as Nasya is contraindicated in Ajirna, but it can be done with Kapha Vriddhikara Lakshanas like Shirogaurava, Aruchi, etc. Please explain how Nasya practically done in such cases.
No problem. We go with Deepana Pachana, best therapy. Even by Deepana Pachana, or even by fasting, Langana, even the Lakshanas will come down. After that, you can carry on, no problem. You can do it. Just 3 days you can go with the Deepana Pachana drugs. Simple, equal to that you can 3 days, then followed by the Nase, you can do it.
Thank you so much, sir. That brings us to the end of this question and answer session. Thank you to everyone who participated by sending thoughtful questions. As we come to the end of this session, I warmly invite Dr. V.M. Hugar, sir, to deliver the vote of thanks.
Namaste, one and all. It is my pleasant duty to propose the vote of thanks on behalf of Department of Panchakarma, Tarnath Government Ayurveda Medical College, Bellary. I express my sincere and heartfelt gratitude to our esteemed speaker, my beloved Guru, Dr. Shashidhar H. Doddamani, sir, for sharing his valuable knowledge, vast clinical experience, and scholarly insight on Panchakarma in routine clinical practice, assessment of patients, acceptance, and therapeutic outcome. Namaste, sir. Thank you so much for your valuable time with us, sir.
Namaste, namaste. Thank you so much for the opportunity. I thank once again all.
Our sincere thanks to respected Principal Sir Dr. Rajshekar Gandhir Sir, respected Janki Madam, our respected HOD Dr. Santosh Edarli Sir, all faculty members, organizing committee, teaching team, technical team, all participants for their valuable support, active participation, which made this session a grand success. Thank you one and all for joining with us. Namaste.